Hello, everyone. This is Dr. Khan, Executive Plastic Surgery. I have a wonderful patient of mine. She's actually right here. She is the one where on the 14th of April I did the Facebook Live. She is 89 years of age, and I have in the middle her lovely daughter. She's been there from the beginning to the end, making sure everything is taken care of. And truly, we want to learn from your experience. We want to basically share your journey, because like you, I will tell you there are, I will say easily, millions of patients out there who have implants that are old, decades and decades old. You're 89 years of age, and you had your implants done in 1973.
I was 38 years old.
38, yeah. So 38, and this is your one and only set. Now, I saw you initially for the first time in clinic along with your daughter, and you came in to see me, and I remember you were walking with a cane. And, and we have seen patients from all walks of life, from age 21 all the way up to 89, and you're certainly my oldest patient. Now, your chief complaint was why did you want your surgery done at this?
Well, they'd been in for 50 years, and I began to notice that they were hardening, especially the right one. Mm-hmm. And it was distended, it was large, getting larger.
Right. You had what was a grade 4 capsular contracture, which is the largest contracture, the highest of its kind, where it was extremely hard, very swollen, and painful. Because you had mentioned...
Well, I didn't have much pain.
You did not have much pain?
No,
okay.
It wasn't a pain issue with me. It was kind of scary. I thought something was going wrong.
Okay.
I did not know that now it's recommended to have them renewed every 10 years.
Right, 10 to 15 years or sooner.
For 50 years, and I was frightened that something, really, really bad was going to happen next.
Mm-hmm. So you noticed the swelling?
Yes.
When did you notice the swelling for the first time?
I really don't know how to answer that because I don't remember.
God, it's very subtle. It comes on very slowly. Okay. And so for how long were you thinking about getting the implants removed?
Couple months, probably.
Oh, no, it's much longer.
Yeah.
So about 2 or 3 years prior to the surgery is when my mom first started telling me on a frequent basis that she was experiencing swelling and hardness and some concerns. And I told her about 2 years ago about my friend who had been to see you and who was advocating, for all women to look into having implants removed. And at the time, my mom had so many other health concerns that it was kind of way down the list for her. But after she dealt with some other health issues, she really wanted to have it done. And so that's when we made the appointment. Mm-hmm. So that would be last fall. Right.
Now you had, some previous significant cardiac history. I got the cardiac clearance. We got information from your cardiologist who gave us the green light to proceed, that you were optimized and you were ready for your surgery. And your exam, when I examined you, I really did not want to operate on you because, whenever you assess anyone, you look at the risk versus benefits. But when I saw how this right side was so much swollen, significantly so, and for everyone who's listening, please go to the Facebook live that I did from the hospital on the 14th of April. Now, as I understand, Facebook now does not allow or does not retain the information past 1 month, but we're going to go ahead and post it because we did download it, as I understand, if I'm not mistaken, and we will share that because you had severe inflammation of that capsule. And I remember when I got that end block, right side and left side, there was a hemorrhagic severe inflammation, extensive inflammation. Your capsule was almost 2 centimeters or so thick. you know, and this was hemorrhagic blood within all contained, done en bloc, and your pathology report came back which showed fat necrosis on the right side. That was the much worse side, and it was right in the proximity of the skin. And so these were significant findings also on the left side with fat necrosis, dystrophic calcification, and reactive changes. Now, we had a wonderful team that day at the hospital. We had a wonderful anesthesiologist and the CRNA who was there to manage your case. Blood loss was less than 5 cc's. Now, let me ask you this. What was going through your mind? Like, how strongly were you considering the surgery?
At what point in time?
Like, from the first time, before, the week before, the month before, did you really want to do this? Why did you want to proceed with the surgery now that you had had these implants for 52 years?
I was afraid that the condition would get worse, and I wasn't sure what could happen.
Right. No, I will tell you, if anyone, to just look at the Facebook Live, and we'll post this. If you look at the video, that in itself will speak for itself, the significant inflammation. One of the most inflamed implants and capsules that I've removed in my career. And your case was certainly very, very tricky, especially on the right side. And this was the reason. And I said to myself, you know, there was a big part of me that, and I said to you, I did not want to operate. I was looking for every reason to not to. But when I got the cardiologist's feedback, the clearance, and I talked to you how motivated you were, because believe it or not, that has a lot to do with your recovery, and how good a support you had. That was a big integral part, because I made sure that you were going to be around not for one day, but for at least a week, if not longer, and that you would get all the support at home 24/7. So that was a big thing, and we moved the dates around such that you would work around your schedule, and that you were mentally prepared. And I knew no human should live like how you were, because you have many more years ahead of you, right? And meaning no one should be in that state where they have significant swelling on the right side. It was shiny red and extremely inflamed, extensive inflammation, consistent with dead fat that was seen not only on the right side but also on the left. I like what you said, that I did not know that these are not lifetime devices. Now, what I want to do here is I'm going to go ahead, and this is from the FDA warning and the manufacturers themselves, the black box warning. The first thing that they mention, breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. And this was the rupture on the right and the rupture on the left, both ruptured silicone implants that you had, with the hemorrhagic fluid, which was the bloody fluid within, all contained in the capsule. The other thing I want to mention by doing the Facebook Live, and I appreciate you coming forth and sharing your journey, to both of you, that everyone, you got the same surgery that I offered the 45-year-old, the 22-year-old, to all ladies. I didn't compromise on your surgery, so that you got the same technique, the same results, no need for drains. And I have to say, you certainly did not need a lift. If you, because even at your age, I just want to mention, you truly did not need a lift. Because your surgeon, the initial one, when you had your surgery, did a wonderful job. And you had, relatively speaking, large implants. When I looked at the implants, I couldn't tell what size or what volume it was, and what the make or the model. These were that old, from 1973. So you got the same surgery that all my patients get, and the whole care and finesse was the blood loss was less than 5 cc's. All of the capsule, inflamed tissue, and the ruptured implant was removed en bloc, the gold standard. Cultures were done for bacteria and fungus. Everything very nice, went very nice and smooth. They kept you in the hospital for a few hours after to making sure that your heart rate was back to normal, and you indeed were discharged later on that day.
The same day.
Yes, and you met criteria per the intensivist, the anesthesia intensivist, who kept a close eye on you, and you met criteria for discharge. And the point here is that when you get the appropriate workup, even with the significant previous health issues you had, you were optimized and you had your surgery done. What else would you like to say to, now there are many patients that I talk to from all walks of life, from all over, who have ruptured implants, who have implants from the 70s and 80s and 90s, and who have grade 3, grade 4 capsular contracture. I want to go ahead and say no one should have to live with grade 3 or grade 4 capsular contracture, which is hardening of the implants, swelling, pain. No one should have to live with the uncertainty of that fluid. Remember, all of it was tested, and that you have that complete peace of mind that all the badness was removed, all good, healthy, viable tissue was remaining behind, and that all the badness that was removed was also tested for ruling out that rare BILCL, that lymphoma, breast cancer, malignancy. Cultures were done for bacteria and fungus. And overall, I couldn't be happier with how the post-operative recovery went. Now, do you have anything to say?
Well, I've been saying two young women of my acquaintance who they've said something that leads me to believe they are considering having this done. Don't do it, people.
You mean getting implants put in?
Yes.
Put in. Don't do it.
Yeah, and I will tell you, what do they say? An ounce of prevention is better than a pound of cure. So there was a lot of good that you did, and good for you that you're spreading awareness. It's not worth it.
It's not worth it. Vanity is not in your favor.
Yeah, but are you glad you got them out?
Oh, absolutely.
Do you feel anything different now compared to like 6 weeks ago when you had your surgery, or 7 weeks ago?
I've been waiting for kind of a bounce in my energy level and fatigue reduction, and so far it really hasn't happened. But I'm still healing.
Yes, you're still healing. Just the recovery. The take-home message for everyone, please, absolutely, we will post the video, from this date of the surgery. I did the Facebook Live, so you can see exactly for yourself. This is part A of the Facebook Live. I should say part B of the Facebook Live. Part A of the Facebook Live is what happened on the day of the surgery itself, so you can see firsthand exactly what was inside your right chest and also your left, what was removed, and how the surgery proceeded without the drains, without the need for the unnecessary lift, even at your age. And clearly you did not need the lift with the anesthesia that you got at the hospital, with the pathology workup, microbiology workup. You did a wonderful job with compression, so excellent job to you as well for making sure. And I have to say there was a very good, healthy communication between the three of us, because you were the link to Mom, and it was as if I was talking to Mom, and the post-operative recovery, everything went very well, and I couldn't be happier with how everything went. Now, please.
I don't want to interrupt you, but I'm not sure what you mean by lift.
Oh, lift meaning that you were to get
breast lift.
A breast lift, a mastopexy, basically lifting the breast tissue up such that it would be much higher up in the chest area.
So I have to say that working with you has been amazing. You've been so responsive, and every concern or issue that we had along the way, you addressed it, and that's so appreciated. I mean, it's been extraordinary, and I really appreciate it.
No, I will tell you, it is from Emily, from Mar, from Sally, from everyone in the team. It's a concerted effort, and we make sure that every patient gets the best care, just like you did, and just like all the patients we saw today from literally all walks of life. We had a patient that got her implants just today from Spain. You know, we saw a lot of interesting patients in a sense that one of them I saw earlier this year, and she came back with both ruptured implants. And these implants were just 11 years old. Just 11 years old. So this is a patient that I saw today. Another patient, young lady, she got her implants at age 18 in Spain. And then in 1997 and in 2005, she got them replaced because she wanted to go larger implants. And lo and behold, when they changed the first set, she was noted to have one side ruptured already in the 8 years that she had her implants. Wow. If you had your, and so this was a second patient, and the third patient was a young lady, 43 years of age. These are, by the way, patients that I just saw today. 43 years of age, she had her implants just 2 months. Just 2 months. So we have, you know, so wow. The youngest, yeah, so this was a 43-year-old with history of breast cancer on the right side. She was nursing her baby, and the next thing you know, she felt a lump, and it was subsequently worked up only to find out that she had 3 out of 19 lymph nodes positive. And so she ended up getting nipple-sparing mastectomy, and she said capsular contracture, and she had to get radiation and eventually a replacement of implants. And young lady, 43. We have had another lady that came. She had saline implants, 36 years of age. She had her implants that were in for approximately 15 years, done through the belly button. You know, so saline implants. And so, and 2 other patients, you know, and again, patients complaining of many symptoms of breast implant illness. Not everyone does not get breast implant illness. The longer people have them, just like I read, the higher the chances for complications. And so this is where every patient had some sort of a complaint, be it the neck, back hurting, neck pain, back issues from the heavy implants, ruptured implants, like I said, and one complaint after another. And the take-home message is do no harm. And for everyone to know that they are not lifetime devices. There is a very rare small association with lymphoma. The fluid that you had, all the swelling that you were complaining of, was all tested for CD30 analysis that was negative for lymphoma, like negative for cancer, malignancy, and this is the report that I have. The cultures were done, and so you have that complete peace of mind that everything was removed and tested, and that you know, you were well read as you came to me. That's important for the many patients. I will end on my end, and then I will let you both finish. This surgery, if you ask me, is all about respect. Respect to the tissues, respect to the patients to be heard, respect that every dissection that's done in the operating room is done very meticulously, very carefully, such that there is no break into the capsule, that end block is done, that all of the tissue is removed. This is not about how fast you are. It's all about how efficient, how practical you are, how real the surgery is, in a sense, how genuinely from the heart it is done. This is a surgery where care and attention and meticulousness comes into play. Experience comes into the play. Anticipation of the worst comes into play. Making sure we get the complete workup done, not rushing into the surgery, right? All of that comes into the play. Making sure that you are well read and prepared for the surgery, because it's a very big deal when you go back home. What do you do next? What is it that to anticipate? Remember back then, there was a lot of questions you had, and we went back and forth, taking the medications, being on top of things. And, you know, at the end, when we look back, I will say I could not have done the surgery any better for you or for anyone else of the thousands of surgeries that I've done. And not only in the manner that it was done, but the post-operative care. The best post-operative care for the patients is the best pre-operative care and intra within the operative care, so that you have a nice post-operative smooth recovery with the least amount of turbulence. So I will let you say, or if you want to say a few words to anyone who's listening.
Don't do it.
That's very powerful. Yeah.
So, yeah, I would say I have noticed a difference in Mom. She may not notice it, but her posture, I mean, she already has issues with the posture because of the scoliosis that she has, but because the implants were so swollen and so heavy and so hard, she had really gotten hunched over, and all the muscles in her neck and shoulders were like hard as rocks. But I noticed in the last couple of weeks, her shoulders are soft, her neck is soft, her body's relaxing, and to me that's a huge difference. And the other thing I wanted to just say is that, so every step of the process, I felt confident and comfortable through it all. I knew what to expect. And, you mentioned earlier about the week, 24/7 care for the first week after the surgery. So thankfully, we knew about that well in advance. I could arrange the time off from work. I could arrange that we had some help at the house. And I've felt very comfortable all the way through the process, knowing what to expect. And anytime we had a question or concern come up, with wound care or anything like that, you were always right on top of it, and that is not common at all. Mm-hmm. And I just want to give you the appreciation for that.
No. Thank you. My pleasure. It's a big responsibility that you put your health in my hands, and it's my responsibility to basically give the best I can. Yeah. So.
Well, you did just well.
No. Thank you. My pleasure.
Yeah,
All right.
Thank you.
All right. Thanks. Thank you.